When the first signs of cardiac distress happen, you need to get to a hospital, of course. But what happens after that appears to depend on your gender. A new study is suggesting men get quicker treatment. Our health specialist, Crystal Gamansing, is looking at why tonight.
Cooking, cleaning, caring for the family. All those things that keep you hopping could also keep you from getting life-saving health care. McGill researchers discovered treatment times for heart attacks varied between the sexes. Women waited longer for heart tests and clot-busting drugs compared to men. But when Roxanne Pelche and her team dug deeper, they found something even more interesting.
We observed that it's not just about being a woman here. It's rather having the roles and traits that are traditionally attributed to being a female.
In other words, the main caregiver. More than 1,100 patients were recruited for this study. All were 55 or younger and from Canada, the U.S., and Switzerland. The study doesn't explain exactly why this group saw a delay in care. It could come down to how they presented their symptoms to the triage nurse.
If you are a caregiver, whether you're a woman or man in society, you tend to give your self-care less, and we need to make sure that we're taking time for ourselves.
Dr. Beth Abramson is a cardiologist and spokesperson for the Heart and Stroke Foundation. She says you need to know your risk factors, and any sign of chest pain should prompt a call to 911, and you need to express that clearly to medical professionals.
Don't be selfless. It's okay to seek help. Make sure you're getting the right care you deserve. It's an equal opportunity killer.
More young Canadians are having heart attacks and strokes. Cardiovascular disease is a leading cause of death in this country. A lot of attention recently has been on women and risk factors.
It is indeed really interesting because, maybe the focus should not be put on biological sex per se, but maybe rather on gender-related characteristics.
Now, the researchers at McGill will be following up on this paper to see if that delay in care resulted in any sort of negative health outcomes. And we have, Leslie, had other studies that have suggested that females have a poor life expectancy and actually die sooner than men who have had heart attacks. So there is a correlation here.
So let's work this out. I get to the hospital. Should I react differently or speak up less than you would have to?
You really do need to speak up, be very clear, be concise, and if you're having some chest pain, some heart issues, don't brush it off. If you're one of those people that think, oh, I can't spend a lot of time here, be clear, be concise, say, I think I may be having a heart attack.
All right, if you're going to speak up, that's the time to do it.
Absolutely.
Thank you, Crystal.